Case study, protein, good nutrition and uterine fibroid treatment. About 80% of all women in the US have benign tumors called fibroids which grow on the uterine wall. Only about 25% of women with fibroids ever notice them because they are not large enough, but fibroids are the main reason for hysterectomies in the United States. Fibroids can cause heavy menstrual bleeding and cramping, pain or pressure in the pelvis, complications during pregnancy, and painful intercourse. The main risk factor is a family history of fibroid tumors. Treatment of fibroid tumors. Other than having a hysterectomy, there are alternatives when it comes to treating fibroid tumors. Many physicians recommend birth control pills. These will not actually affect or change the tumor, but they will ease some of the symptoms, including excessive bleeding. Women who wish to get pregnant can undergo surgery to remove the fibroid tumor, but there is always the risk of the tumor returning in the future. There is also a new treatment which involves a specialized ultrasound which takes about 3 hours to complete. Maintaining good health is necessary in the treatment of fibroid tumors, and this includes exercise, quitting smoking, maintaining a healthy weight, and eating a healthy, well-balanced diet. One important macronutrient that is necessary for survival and ideal for treatment of fibroid tumors is protein. Protein is made up of hydrogen, nitrogen, oxygen, and carbon. Dietary treatment for fibroid tumor patients. It is essential for everyone, not just patients with fibroid tumors, to eat a well-balanced diet that has all of the essential macronutrients, protein, carbohydrates, fats, vitamins, and minerals. About 50% of a healthy diet should come from carbohydrates, with 30% coming from protein and the other 30% coming from fats. The American Heart Association recommends that no more protein be taken in than this amount for optimal results. Include these foods in diets for fibroid tumor treatment. Patients with fibroid tumors are often encouraged to add soy products to their diets because soy is a complete protein, containing all 22 of the essential and non-essential amino acids. Fiber is also recommended as it is one of the best ways to help the liver process and eliminate excess estrogen. Some of the best sources of dietary fiber include whole grains, beans, tofu, and miso. There are also many protein supplements made from soy that are great additions to any diet. Other foods that are healthy sources of protein, and good for patients with fibroid tumors are cold water fish, including salmon. Vegetable proteins and protein supplements are a great way to start out. After a few months, patients can begin adding hormone-free animal proteins to their diets. Avoid these foods. Because fibroids are fed by estrogen, patients should definitely avoid any foods that have synthetic estrogens, such as red meat, poultry, eggs, and dairy products. Because these are also dietary sources of protein, patients must find other alternatives to get the protein they need in their diets. Using protein supplements. Protein supplements are a great way to get the right amount of protein in your diet, and one supplement in particular, ProfectR by Protica, is great for all diets. At only 100 calories per 2.9 fluid ounce serving, ProfectR provides 25 grams of protein per serving. It also contains no fat or carbohydrates. ProfectR protein supplements are available in blue raspberry, grapefruit mango, fuzzy peach nectar, cool melon splash, passion fruit and fresh citrus berry. Other protein supplements that are very popular include protein powders. These are one of the most versatile types of protein supplements available. Not only can you add flavorless protein powders to just about all of your favorite recipes, there are also delicious flavored powders that can be used to make great tasting shakes, smoothies, and slushies. Protein powders come in a number of flavors, including berry, fruit punch, chocolate, and vanilla. Protein shots. This is a great way to get a whole lot of protein in one small drink. These shots are less than 3 ounces and provide 25 to 30 grams of protein in each low-calorie serving. Protein shots are available in such delicious flavors as green apple, raspberry, lime, and grape. Liquid protein supplements. These are available in a number of ready-to-drink shakes and smoothies, such as chocolate and vanilla, and there are also flavorless liquid protein supplements that can be added to many recipes. Because many of these supplements are made from milk-based proteins, people who have milk allergies or who are lactose intolerant should read the ingredients carefully to make sure these ingredients are not included in a particular supplement. Marie, a patient with fibroid tumors, adds protein to her diet. When Marie was diagnosed with fibroid tumors that were not large enough to bother with surgery, she asked her doctor how to treat them. Her doctor initially recommended birth control, as Marie reported heavier than normal menstrual bleeding and cramping, and told her that the pill would ease some of her symptoms. Marie's doctor also recommended that she make some drastic changes to her diet, including eliminating red meat and other animal sources of protein. Marie, who has some understanding of nutrition, asked her doctor how she was to get the protein she needed in her diet without eating these foods, and was told that in addition to a number of healthy, delicious vegetable proteins, such as soy, a complete protein with all 8 essential amino acids and all 14 non-essential amino acids. Marie's doctor also recommended that she add protein supplements to her diet. One supplement that was mentioned was ProfectR by Protica. Marie's doctor told her that this supplement was terrific for just about any diet, because it not only contains 25 grams of protein per 2.9 fluid ounce serving, it contains no fat and carbohydrates and is only 100 calories per serving. Marie followed her doctor's recommendations, and soon found that her symptoms were not as severe as they once were, and the need for any surgery had been eliminated. Because she was so happy with her new diet and how good it made her feel, Marie continues to use protein supplements each and every day for health and energy.